exam. And it was very, very normal this morning. He looks terrific, but I did see something I want to show you that concerns me.
Oh no.
Come here, handsome. Let's see that mouth. All right. So if you look at that big back upper molar, Dunner has what we call a slab fracture. And that is what happens when the side of the big molar splits and gets cracked off. So Dunner was happily chewing on something way too hard, and he bit down on it and cracked the side of his tooth off.
Oh my God.
It can be serious. There's the risk that infection can climb up the tooth root that's exposed now and get up and form an abscess. So the result can be the loss of that tooth and an abscess in the bone.
So what do we do?
We're going to do a complete dental on Dunner.
Mm.
We will take care of that. We will extract that tooth and clean and polish the remaining teeth. We'll use x-rays to identify any further problems.
Why do you have to do that? It just sounds so complicated, and I'm just worried about the cost and anesthesia, and I don't know, he's never had anesthesia before. Well, I guess he did when he was neutered, but
Sure.
that was a long time ago, and he's getting older now. I don't know, so many questions.
Sure. Well, to start out, we need anesthesia because we're going to be extracting that tooth. The roots of the tooth climb very, very high, much further up than our tooth roots do. We need anesthesia because in order to properly clean his teeth, we have to actually go under the gum line, just like they do when they scale your teeth. Dogs can't tolerate that unless they're under an anesthetic, and he simply wouldn't be able to hold still enough for us to do a proper job. We are very careful monitoring under anesthesia. Before he'd get under anesthesia, he'd have blood work done. I'd make sure his liver and kidneys are functioning normally and can handle it. During the anesthetic process, he'd have an intravenous catheter and a blood pressure monitor, even an EKG running the entire time. We have a whole monitoring setup that I'm happy to show you.
And what would happen if I don't get this done?
Well, the risk would be if the root of the tooth was exposed, not only would it become painful, but bacteria can climb that root, go all the way up into his bone. The roots extend all the way up to his cheekbone. Dogs that have this problem that we don't identify or don't treat will come in and the entire side of their face is swollen and oozing because of the abscess. It becomes a huge problem at that point, and it's something we can much more easily correct before it happens.
Okay. That makes a lot of sense, yeah, for sure.
Okay.
And then what will he do about eating afterwards? Will he be able to eat and play and chew on toys and everything afterwards?
Absolutely. In a short period of time, just a few weeks, he'll be able to go back to eating dry food, and you'll find that he's playing normally. In fact, some of these dogs will often go back to playing better than before because they were protecting the tooth that was uncomfortable. You can imagine in your own mouth, if you broke a tooth, you'd simply avoid eating on that side. He might already be doing that without showing you anything, and once I get rid of the damaged tooth, he might return to playing with his toys where you hadn't noticed he wasn't before.
Yeah, he has actually been avoiding, now that you're saying that, some of his harder toys that are harder, surfaces are harder, so that does make a lot of sense.
This is the table that we use for all of our dental procedures. We use a heated water circulating pad to keep the animals comfortable and to maintain body temperature, especially for small animals. This is our anesthetic machine, which allows us to maintain anesthesia at a healthy plane. This is our monitoring equipment. We are able to monitor heart rate and rhythm, oxygen and CO2 levels, and we also are able to monitor blood pressure. That's a tiny blood pressure cuff. This is our dental cleaning and polishing equipment. Does it look familiar? It should. It's the identical equipment you'll see in your own dentist's office.
Oh, my Bobby. Oh, my goodness. Oh, where'd you go? Huh? Did you go for a big sleep someplace? Sit down. Oh. You're a good boy. You're a good boy.
So, Dunner is back for his 2-week recheck. How's everything going?
First of all, I cannot believe how quickly he bounced back from everything, and I was so worried about anesthesia, but he just did great. He was back to himself that night, and the day that you did the cleaning, and the extraction didn't seem to bother him at all. He just was such a good sport about the whole thing.
So how's he doing now, playing with his toys and his chew
Well, I feel
toys?
really badly because I feel like it must have been bothering him before, because there are certain toys that I just realized he wasn't playing with, and he dug them out of his toy box, and he's playing with everything now. So I can really tell he's a lot more comfortable. I'm so glad that I did it, because I feel guilty now that I didn't realize it before.
That is not at all uncommon. In fact, we hear that a lot after we extract a broken tooth. People think that their animals are just getting older and not playing, but it turns out they've been uncomfortable and just compensating for it. So I'm glad to hear that he's doing so much better.
When can I start brushing his teeth? Because now that I've had it done, I don't want to go backwards. I want to make sure that I do the right thing going forward. So
Excellent. Well, we're going to start that today, and I'll show you how. So, dogs' teeth do not have flat molars like we do, so you don't have to go into the mouth to brush them. You're really brushing the outer surfaces, which means it's much easier than most people realize because we can do it with their mouth gently held closed. And you want a soft toothbrush with the right size to fit into his mouth. We do have different sizes available here. And a flavored toothpaste will make the whole experience more pleasant. So be sure you're gentle with it. And gently hold his mouth closed. Go up under those lips. Hi. And make sure you get to those back molars around there. And around the other side. Oh, I know. It'd be better if I had the good toothpaste, wouldn't it? Your goal is to try to brush every day. Just like our mouth, we want to get the sticky plaque film off before it turns into that yellow tartar. And that happens at just over 24 hours. So you really want to shoot for every day. If you make it a habit with him, and even better, if you follow it with a treat. All he'll know is that once a day he gets a treat, and he'll come and remind you, especially this personality.
That's awesome. And do you use toothpaste? What are you supposed to put on the brush?
You can't use human toothpaste because it has soapy agents that make the foam. Yes, that is where the cookie was, but not now. So you can't use that on them. We do have flavored toothpaste in yummy flavors for them, like poultry and things like that, which would make the whole thing